I know we'll be coming back to you later on just to paint for us a picture of the mood that is at Kenyatta National Hospital, especially amongst the health workers, the first frontline workers to get this vaccine. But then, talking about the frontline health workers, so today I'm having the conversation with the National Nurses Association of Kenya President Alfred Obengo, and also joining us will be the KMPDU Central Region Secretary General Dr. Gor Gudi, just to tell us why the health workers, the nurses, the doctors are a bit hesitant, in being the first people to get the job. And thank you for joining us this morning here on KTN News Center. So let me begin with the hesitancy that the nurses have in terms of getting the job.
Thank you. I want to say from the outset that actually we applaud and support the government insofar as this vaccine initiative is concerned. And secondly, we also appreciate the fact that the COVID vaccine initiative is a global phenomenon. It's just a Kenyan phenomenon, just like the COVID-19 pandemic were. And that being a fact, our job and our role as a professional association is just to complement the government initiative in terms of combating the disease is concerned. But also, having said that, it's also important that as we roll out this vaccine initiative, it's very, very important for the Ministry of Health, particularly, to engage all important and relevant stakeholders so that to enhance the acceptability of the vaccine within the healthcare professionals and the healthcare workers.
So what you're telling us this morning is that there was a lack of stakeholders' engagement?
Yes, that one was not actually done from the outset, but given the noise and advocacy that we've made, the engagement has started, but though belated. This is something that should have started from the word go, from the planning sessions. We should have been involved, because you realize that actually the person who's gonna give this vaccine to the populace actually is the nurse and the other healthcare workers, public health officers. So it would have been important to engage them. And secondly, apart from engaging them, there's the issue of sensitization, because there are also fears and misconceptions that are surrounding this vaccine. Just like we had the fears and misconception that was surrounding the COVID-19 disease. But we were able to defeat these fears and misconceptions by providing facts, providing the correct information to the health workers and to the populace. So
how many nurses have so far been trained? Because the government has been talking about, the government through the Health CS Mutahi Kagwe has been talking about training health workers, the nurses, on how the vaccine should be stored and administered to Kenyans.
From where I sit, and also engaging our people on the ground, I've just had this information from the task force that they have been training health professionals on the same. But from where I see it, having inquired from the nurses across the country, none of them is aware of any colleague that has been trained.
So none of the nurses, none of the union members have been actually trained?
That's what I'm saying. From where I sit, I'm not aware. That's why I'm saying this engagement should have started earlier, with also involving the professional association. I can tell you this for a fact, that even when we started training health workers in case management of COVID-19, you remember when the first cases of patients who are going to the clinical environment with the symptoms that are suggestive of COVID, health workers could take off because of fear. But that fear was defeated through sharing information. And that's what I'm saying. And even that particular time when we are training health workers about case management of COVID-19, actually the professional associations came in and widened the coverage insofar as training is concerned. So we want to tell also the government that even on the issue of the vaccine, you cannot do it alone. Involve other stakeholders to help you.
So now that the training has begun, but at a later stage, are the nurses willing to be the first people to take the jab? Because the vaccine is already at KNH, you're just waiting to see who will be the first person.
In United States of America, the first American citizen to take the jab was an ICU nurse. That tells you that actually the global political setup actually considers the nurses, the health workers are the frontline warriors and the people should be given priority. Having said that, but we need to still sensitize our people. There's a mixed reactions from the health workers, which I'll not lie, insofar as receiving or not receiving the jab is concerned. And we must also underline the fact that receiving the jab is actually voluntary. So no one should be coerced into receiving it. But at the end of the day, we know that is an initiative towards actually cushioning us from the adverse effects of the COVID-19 pandemic. But the reactions out there is still mixed, whether to receive it or not. And for us, and as a leader, what I can really emphasize is that we need to step up the sensitization so that we can allay, we can defeat the fears and the misconceptions outside there. Right. And our job actually is to complement the government, but we can only do that if we get the right information. We can also be the best ambassadors insofar as this initiative is concerned, if we are involved at every stage and information is shared with us.
So just from your answer, there is no assurance, 100% assurance that nurses will be the first people to take the jab. Okay, just stay with me. We need to take a short commercial break, but when we come back, we'll continue having this discussion with the National Nurses Association of Kenya President Alfred Obengo about the nurses' sentiments and the doctors' sentiments about this COVID-19 vaccine that arrived in the country on Tuesday night.